Nurse burnout is a physical, mental, and emotional state caused by chronic overwork, excessive prolonged stress, and a sustained lack of job fulfillment and support. The video included is a great way to understand burnout and its impact on the nurse.
Jimmy is a recent grad from psychiatric nursing. After spending so much time studying, he is ready to join the workforce.
You look hungry.
After just a few months of full-time work, Jimmy is beginning to push himself to the limits.
Hey Jimmy, go for your lunch already.
Jeez, I don't have time for that. Not today. I got way too much stuff to do.
Suit yourself.
I'm swamped.
Jimmy starts to notice how tired he has been getting. He has a pounding headache most days. His shoulder muscles are tense and he is losing weight. Unknowingly, he is pushing himself too hard. This lack of energy is starting to show in his work.
Mr. Chase, I brought your medication here.
Jimmy, what are you doing? Those are Mr. Johnson's medications, not Mr. Chase's.
Dear God, she's right.
These aren't my pill, you idiot.
What was once an easy task for Jimmy has quickly become an area of difficulty. Jimmy is experiencing trouble at home, too.
The burnout experience can be described in 3 dimensions. The 3 dimensions of burnout include exhaustion, cynicism, and inefficacy. The exhaustion dimension is defined by fatigue, depletion, and loss of energy. The cynicism dimension is categorized by negative attitudes and withdrawal. The inefficacy dimension represents the inability to cope and lack of accomplishment. Conditions that foster the development of burnout include short staffing and unsafe nurse-to-patient ratios. Studies have shown that nurses who work short-staffed are more likely to experience burnout and job dissatisfaction. Lack of support from management, poor leadership, lack of teamwork, or management issues are among the top stressors. Long work hours can also lead to burnout. A study proves that longer work hours, commonly 12-hour shift, directly correlated with a lower level of patient and nurse satisfaction. Other conditions that foster the development of burnout are poor work environments, greater workloads, which correlate to short staffing, and also working with death and sickness. According to the American Nurses Association, 1 in 3 nurses report inadequate staffing levels. 2 in 5 units are short-staffed. Additionally, 54% report excessive workloads. 96 out of 100 nurses report fatigue at the beginning of their shifts, and half of nurses say they spend insufficient amount of time with their patients. Burnout negatively impacts a nurse's physical and mental health. Physical signs include exhaustion, anxiety, frequent illness and sickness, headaches and muscle pain, change in appetite, weight loss, and change in sleep habits. Behavioral signs include withdrawn, increased preferences towards isolation, poor judgment calls, procrastination, frustration, substance abuse, and skipping work. Emotional signs include helplessness, sense of failure, self-doubt, detachment, lack of motivation, cynicism, and decreased career satisfaction. Burnout can have a negative effect on patient care quality and patient safety. Burnout leads to inadequate standards of patient care, which leads to poor decision-making, putting patient safety at risk. Burnout contributes to poor patient engagement, and this leads to decreased patient and family satisfaction and poor patient health outcomes. Additionally, burnout can cause turnover and nursing shortage, which leads to high nurse-patient ratios. Burnout prevention. On an individual level, individuals can practice resilience to develop a healthy coping mechanism to lessen the impact of trauma, or emotional stress. Individuals can practice self-care, which includes healthy eating, healthy diet, and regular exercise. Extracurricular activities away from the job, and also individuals can seek support from professionals if they are unable to cope. On an organizational level, the organization can provide ongoing support to workers who are at risk through proper screenings and counseling. The organization can promote and create a workplace with respect, teamwork, and collaboration between nurses and other healthcare professionals. More importantly, the management and leadership of the organization can provide adequate staffing and a safe work environment. Although short staffing, unsafe work environments, and an unsupportive management foster the development of burnout, nurses still need to make time for themselves and focus on their health and well-being. These are just some self-care tips for nurses and healthcare professionals in general. Nurses must still continue to fight for their rights, fight for safe staffing, and fight for policies to be implemented that support nurses.